Assalamualaikum and a very good evening to Dr. Ali. Today, my friends and I are going to elaborate on our project that we have been produced. We are going to discuss on the mental health problems. So we have illustrated the definition, the diagnosis, the symptoms, as well as the solutions to these problems. So my name is NURUL MUZAMMIL with metric number 266751. I'm going to elaborate more on the definition of the mental health problems. So mental health is comparable to physical health in that it is something that the patients have and that they must take actions to keep it. People with good mental health are able to think like us, feel and act in ways that are consistent with how they want to live their lives, which is an indication of mental health. In the case of poor mental health like them, it may be difficult or impossible for individuals to deal with the way they generally think, feel or behave in certain situations. So a mental illness may as be a burden for than a physical illness at times, and this can be quite stressful. So the negative portrayal of people with mental health issues on television, in films, and in the media often fuels these fears. This could discourage them from seeking help or discussing their problems with others. As a result, they are more likely to feel depressed and alone. Mental health issues as well, on the other hand, are all too common. Almost everyone has at least heard of someone who has struggled with mental illness. It can happen to anyone, regardless of their background or occupation. A combination of self-care and treatment and support that works best for they are likely to lead to recovery. So I'm going to proceed to my friend here to elaborate more on the types of mental health problems. Over to you, Shaiful.
Hi, my name is SHAIFUL. My metric number with 266328. For my part, I want to elaborate about type of mental health problem. There are a wide range of mental health issues that can occur. Some of them have a similar symptom, which means that they may be diagnosed with multiple mental health issues at the same time. Even if they don't have a specific diagnosis, they may still be having a difficult time. Different people have a varying level of experience, which can change at any time. First, depression. When they are depressed, they have a long-lasting feel for low mood that affect every aspect of their daily life. Feeling of hopelessness and despair can be exacerbated by it. It can have a negative impact on their mental and physical well-being of their as their sleep, appetite, and sex drive. Depression, in its milder form, doesn't prevent them from living a normal life, but is common in the most severe case of depression. It possible it is possible to suffer from antenatal and postnatal depression, and there are recurring episodes at the same time of the year. Number two, anxiety problem. Anxiety is a state of nervous fear or worry that they experience when they are concerned about it, about what is about to happen or what they believe may happen in the future. Anxiety attack can happen to anyone from the time to time. However, If the anxiety symptom are severe or persistent, they may become debilitating. As a result, they may also suffer from physical symptoms like insomnia and panic attack. Anxiety disorder such as generalized anxiety disorder GAD, society anxiety, sociophobia, panic disorder, or post-traumatic stress disorder PTSD can be identified through the medical examination PTSD. If they don't have a specific diagnosis, they may still have an anxiety issue. Number 3, phobia. It's not common for people to suffer from phobias, which is an extreme from the fear of anxiety caused by specific situation or object, such as spider. Phobia are formed when the fear is out of proportion to the danger and last for the more than 6 months. They also have a significant impact on how they live and their life. Number 4, obsessive compulsion disorder, OCD. Anxiety disorder such as obsessive compulsive disorder include OCD. The term OCD is frequently misunderstood in everyday conversation, such as when the people describe themselves as a little OCD if they prefer their surrounding to be tidy. In reality, this disorder is far more complicated and serious than commonly thought. Obsession undercome thought, image, argues, worries, and doubt that keep popping up in their head. And conversion of the two main components of OCD, repetitive activities, and they feel they have to do to reduce the anxiety caused by obsession. Number 5, personal disorder. A personal disorder is a mental health condition characterized by persistent difficulties in one day-to-day life as a result of one persistent attitude, belief, and behavior. Although this changing unwanted pattern of thinking about their self and others, is that it may be hard for them to do so, despite the fact that there are numerous types of personal disorder. Most people who are diagnosed with the don't fit neatly into any of these categories. In addition, the term personality disorder can be perceived as a form discrimination. Consequently, it's a diagnosis that generates a great deal of discussion. There are some physical there are some psychiatrists who don't like it because of this. Many people find it more useful to describe their experience in their way. Okay, I'm finished of that. So I pass to my friend to elaborate more. Thank you, Doctor.
Okay, thank you, Saiful. Assalamualaikum, Dr. Ali. Okay, my name my name is Ahmad Ismail bin Muhammad Nazri, matric number 266789. My part is symptoms, conditions, circumstances, and others factor influence the appearance of sign and symptom of mental illness. Emotion, thought, and behaviors can all be affected by signs of mental illness. Example of sign and symptom: feeling depressed, difficulty concentrating or having clear thinking, overwhelming anxieties, and or a strong sense of shame, high and low of elation and depression, reluctance to socialize and participate in hobbies, extreme exhaustion, lack of vitality or difficulty in sleep, delusion, paranoid, or hallucinations that separate one from reality, difficulty comprehending and relating to others, eating habits and drastically alters change in sexual drive, and suicide is addiction. Occ- Occasionally, phys- physical symptom of a mental health disorder manifests as stomach pain, back pain, headache, or other explained aches and pains. Consult their primary care provider or a mental health professional if they exhibit any sign of symptom of a mental illness. More mental illness do not improve on their own, and if left untreated, they can deteriorate and cause causes serious problem. Another complication or effect, mental illness is a significant contributor of disability. Untreated mental illness can wreak havoc on a individual emotion, behavioral, and psychical health. Compilation associated with mental illness may uh, the followings: unhappiness and diminished enjoyment of life, family conflicts, difficulty in relationship, and isolation social. Another additions to tobacco, alcohol, and other substance, absent from work or school or other work-related issue, homelessness and poverty, self-inflicted and other inflict harm, including suicide or homicide. Prevention, there is a no foolproof method of preventing mental illness. However, if they have a mental illness, taking steps to manage stress, build resilience, and boost low self-esteem may help they maintain control of their symptoms. Takes the following step: seek routine medical attention, avoid skipping checkup or appointment with their primary care provider, especially if they are ill. They may have developed a new health problem and require treatment, or they may be experience medication side effect. Keep an eye of a warning sign. Collaborate with their doctor or therapist to determine what might be cause of the symptom. Plan for what to do if symptom recur. Consult uh, psychiatrist or therapist if nothing's any change in symptoms or feeling. Consider enlisting the assistance of family members or friends to monitor for warning sign. I pass to my friend for another cause and the diagnosis.
Thank you, Encik
Thank you, doctor.
Ismail. Okay, firstly, I want to introduce myself. My name is Anas Ahmad bin Hamid. My matric number is 266521. For my turn, is about the causes and diagnosis. For the causes, in general, mental illness are believed to be caused by a variety of genetic and environmental factors. Inherent characteristic. Mental illness is more prevalent in individuals who have a blood relative who also suffer from mental illness. Certain genes may increase their risk of developing a mental illness, while certain life circumstances may precipitate one. Prenatal environmental exposure. Environmental stress, inflammatory condition, toxin, alcohol, or drug exposure during pregnancy have been linked to mental illness in some cases. Chemical composition of the brain. Neuron transmitter naturally occur brain chemical then transmit information to various parts of the brain and body. When this chemical neutral network are compromised, the function of nerve receptor and nerve system is altered, resulting in depression and other emotion disorder. For the others, variety for the environmental is childhood abuse, trauma, neglect, social isolation, loneliness, experiencing discrimination and stigma, social disadvantage, poverty, or debt. For the diagnosis, to establish diagnosis and rule out an associated complication, patient may undergo the following. A physical exam, the doctor will conduct a physical examination to rule out any physical problem that could be causing system. Laboratory tests, they may include a thyroid function test or screening for alcohol and drug use. And psychology assessment, a physical or mental health professional discuss the symptom, feeling, and behavior pattern. Patient may be asked to complete a questionnaire to assist in resolving this issue. And my part is finished. I'm pass it for the AIDA. AIDA sound.
Okay, sir. My name is AIDA HAZIRAH binti RAZAK. My matric number is 265841. Okay. My part is I will conclude what is my friend's opinion about this mental issue. Okay, the treatment is individually according to type of mental illness that will works best for the patient. Often, a communication of therapist is the more effective. Okay, if we have several treatment will be help. Okay, such as for the first is a treatment team. Treatment team may including the following such as a family or primary care physician, a nurse practitioner, licensed assistant psychiatrist, a psychiatrist, medical doctor specialist in the diagnosis and treatment of mental illness. Also have a pharmacy also can in a licensed clinic or the member of the family. For the second treatment is the medicine. Okay, for the medicine is do not cure mental illness. They frequently improve symptoms significantly. Citrus medicine also can aid in the effectiveness of the other treatments such as psychotherapy. The most appropriate medicine for they will depend on their unique circumstances and how their body reacts to the medical or the medicine. Okay, for the third treatment is psychotherapy. Okay, psychotherapy is referred to as a talk therapy, intently discussing their condition, anxiety issue with a mental health professional. They will gain knowledge about their condition as their mood, feeling, thought, and during psychotherapy, they can develop coping and stress management skill as a result of the insight and knowledge about their gains. Okay, for the fourth therapy is the brain stimulating treatment. Treatment involving brain stimulation are occasionally used to treat depression and other mental health disorder. They are typically used in situations where medication and phytotherapy have failed, such as brain solution and and vague nerve stimulation are some of the technical available. And for five opinion is hospital and resident treatment program. That means mental illness becomes severe enough that they require treatment in psychiatric hospital. This is generally recommend when they are unable to care for themselves adequately or are immediately danger in harming themselves or another person. For the next treatment should be as a substance misuse treatment. That substance misuse is an abuse problem frequently occurring with mental illness. It's obstinate treatment and exacerbated mental illness. In the other ways, they will consult their physicians regarding treatment operation. And for the last one for treatment is participating in their own care. Okay, together they and their primary care provide or mentally health profession can determine the best methods of treatment of they considering the severity of their symptoms, their personal preference, medication side effects, and other factors. In some case, a mental illness may be severe enough that a doctor or family member must guide their care until they will enough to make their own decision. That's all for my conclusion and our opinion about this issue.
Thank you,
Thank
Dr.
you,
Ali.
Dr. Ali. See you again.
Thank you, Doctor. See you.